When faced with urgent healthcare needs, the more than 725,000 people living on the South Shore have advanced care right at their fingertips. South Shore Hospital is on a campaign to bring the healing, caring, and comforting our patients deserve to a new level.
My trip to South Shore Hospital was as a result of a fairly violent car crash. I was taken there on Memorial Day, and emergency surgery was performed on my left arm.
Healing our patients with a new state-of-the-art center for orthopedics, spine, and sports medicine located in Hingham.
Not only was the operation done with precision and care, but I believe I was in the hospital for 8 to 10 days afterwards, and the nurses were fantastic. Not only in terms of rehabbing me physically, but mentally. When you're traumatized, you need some support, not only physically, but emotionally, and they were fantastic.
Caring for cancer patients in a new inpatient oncology unit opening in late 2012.
When you get a diagnosis that's as scary as cancer, it's really an emotional experience that takes place over the course of many months. For me, the priority is that I really have to have caregivers that will answer my questions, that don't feel rushed, that look me in the eye, that are honest. I had that sense initially from my physician for sure. And then I think when you're in the hospital, the defining element of your care is the nursing care. It was just stellar. I just felt like people were rooting for me, they were optimistic, they encouraged me. Without the support and care that I received at South Shore Hospital, I don't think I would be doing as well as I am. My family wouldn't be doing as well as we are.
Caring for cancer patients and their families at the Cancer Center.
When I found out I had cancer, I thought about going into Boston and what that would be like, which originally I thought we were going to have to do. And then we realized the hospital's right here, 12 miles from our home. We walked into the hospital and we realized, wow, this is it. Right from the parking lot attendant to Dr. Freda, all the way up. Everyone cared about me like I was part of their family. I didn't think cancer would get me down, but it did. It knocked me right to the ground. And as strong as I was going into it, it just threw me through a loop. I was extremely weak. But being so close to the hospital and getting the care that I got really saved me. And now coming back out of it slowly, I really can feel the power of myself again. I feel so much stronger. And it's only been a month since my last chemotherapy.
Comforting patients and families with our core of home-based clinicians at the South Shore Visiting Nurse Association and Hospice of the South Shore.
My husband Paul was a wonderful man, and we lived together in this house for 25 years. He lived with prostate cancer for 11 years, and it wasn't till the last couple of years that things got difficult, and the last 5 months where things were really bad. Hospice was just wonderful. They always prepared me for what was going to happen next in a very wonderful, sort of gentle way. And in the very end, I actually got right beside him in the bed, and it was just very peaceful. And I fell asleep. And when I woke up, I said to the person who was here, I think he's gone. And she said, yes, his last breath woke you up. So it was just very, very peaceful, and I couldn't have asked for a better ending, really. And I'll always be grateful for that, forever. And that was thanks to hospice, and I really am very grateful for that.
Comforting and serving our region by creating 60 new private inpatient beds opening in late 2012.
I've lived in Massachusetts my whole life, and I've just seen South Shore grow from a small community hospital to a really highly respected regional medical center. Everything from the births that are taking place on the South Shore now, to the cancer care, to visiting nurses, all of those services have just become really top-notch, and I know that that can't happen without sufficient funding.
South Shore Hospital, through their wonderful work, gave me back a piece of my life that could have easily slipped through my fingers. And that meant everything to me.
The need for urgent health care can strike anyone at any time. With your help, your family, friends, and neighbors on the South Shore can have the most advanced care possible, 24 hours a day, 7 days a week.
It was a great experience. If you are unfortunate enough to have or get cancer, being treated at that hospital is the way to go.
With your generosity, the campaign for healing, caring, and comforting can continue our mission to provide the highest level of care to patients.
One reason that I would like to help raise money for hospice is I would like everyone to have that advantage, because it just makes such a difference.
Our patients say it best. Donations are the margin of difference needed to support this valued community resource. Get the satisfaction of helping others and supporting great health care for you and your family. Make a donation. Make a difference.